Welcome to What the Health? The podcast where anything health is fair game. There's a lot of garbage advice and misinformation out there that can leave you feeling stumped and stuck. Together, let's sift through the sea of BS and find the best ways to get healthy and stay healthy. Join the team as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan Turo, Angela Turo, and Dr. Riley Brown.
Good. And welcome back, everyone. It's great to see you. I'm here with Sofya Stearns today, who has been, I was introduced through a mutual friend several years ago. We first met online, right?
Yes,
I met your sister first.
Yes, we did.
And then we were connected online, and I always love to see what you're doing, and we'll talk more about that. But you were prompted to come into our office by our mutual friend because of a pretty significant injury that you had. So do you want to talk about that
I
a little
did.
bit?
So about 7 or 8 years ago, I sustained a really bad back injury. And since then, I've been in a lot of pain.
Yeah.
And I finally got my act together, and that's why I showed up in your office.
Yeah.
I actually thought my neck at some point, which was hurting a lot,
Yeah.
were injury because of my back. And I thought maybe the whole spine is off.
Yeah.
However, little did I know that it was the other way around by when you actually did the x-rays. And you can actually tell more about my x-rays if you like.
Yeah, so, as is a lot of people when they first come into the office, we assess that entire spine because the spine is intimately related with the nervous system, and your nervous system controls every other function of the body. So when we look, and you come in and you say, oh, well, I hurt here, doc. Most health professionals are trained to go to that area of pain. Yeah. And they want to look and they want to assess. And it's, in many cases, very likely they can find something that would explain why you're, feeling the way you are. But the challenge is, if they don't look elsewhere, they might not get the full picture. And so you had a pretty significant injury that ended up to share that a little bit. You were in a hospital bed, weren't you?
I was in a hospital for 5 days.
5 days.
Yes.
Yeah.
That was my whole body started to shut down.
I don't like being in the hospital for 20 minutes.
Yeah, or 10 seconds.
Yeah.
However, they had no idea what to do with me. And everyone was saying, well, you're fit. And the funny thing is the way I injured myself is I was exercising.
You were exercising, of course.
With kettlebells. So, and again, little did I know, when I started doing my physical therapist did tell me that people, in order for you to use kettlebells, you actually have to know how to use them. And he said that he's never seen so many injuries that are done through using kettlebells.
Yes.
So, say the least, I cannot even look at kettlebell.
PTSD.
I do have, yes, not little. However, after, it was the weirdest thing to be in the hospital for 5 days. They had no idea what to do with me. My body parts started to shut down.
Wow.
I had IVs sticking out of every part of the body you can think of.
Do you remember some of the medication they put you on?
I was on 7 different medications.
Oh my goodness. Painkillers,
steroids. And then when I went to see a pain management doctor, she said, I hate to say it, but you're an addict. And I said, what? I'm not an addict. She said, well, you are, because you have been on those medications for over 2 weeks. So we consider you to be an addict.
That was enough, just 2 weeks on those.
Yes. And I said, well, I need somehow to get off now because I have a child in kindergarten. I need to take care of her.
Yeah.
And I'm not an addict by all means. Mm-hmm. And it's just not my cup of tea. And she said, one thing you could do, we could try to wean you off. However, make sure you don't do anything cold turkey. So I came home and I said, well, what do doctors really know, pain management doctors? So guess what I did?
You went cold turkey.
Cold turkey.
Of course you did.
But before she told me that, I did ask her a very important question. I said, what will happen to my body? And she said, you might feel like you're having a heart attack if you do go your whole body just will go in the shakes.
State of shock,
And I was like, oh my God, sounds horrible. However, I'll try it anyways. I need to start driving my child. My husband is traveling. I need to get back into what I was doing. I cannot be vegetable right now. I'm an addict. It sounds horrible. So I came home. It was a Friday night. I'll never forget. I stopped taking those meds. And I'll never forget, Isabella was in the living room and I was making a salad. And out of nowhere, my heart started to pump. I got dizzy, and the anger I felt, if I could, I probably would have smashed something. However, I figured this is exactly what the pain management doctor was telling me about. Do not go cold turkey. Your body will go into shock.
Yeah.
So I calmed myself down. I literally said, this is okay. It will pass. I heard Isabella giggling. She was playing with toys, and I was like, I'm okay. It's all good.
Yeah.
I focused myself on the salad as I was shopping. And that was it. However, if I would not know why I'm having this, I literally probably would call an ambulance.
Yeah.
It was the most horrible experience I've ever had, worse than even being in a hospital.
Yeah.
I think there should be more awareness as well about those horrific pills.
Yeah. Well, and that's, and you said that, 2 weeks being on those, and there are people who get put on some of those, opioid medications.
Teenagers. Young kids.
And that's their solution because they're trying to mask their pain.
And I understand that as well. It made me feel great.
Right?
I was not in pain.
Yeah, you were debilitated.
Yeah.
And so if you could mask the pain, you were hoping that you could function. But the problem is that, the deterioration of the rest of your body over time being on that.
And it's literally puts a bandage on your problem. It doesn't solve the problem.
So let me ask you this then. How long did that withdrawal, how long did that last for you? You said Friday night was
That was it.
That was it.
That
Just
was
a
it.
couple,
That was it.
not an hour, 2 hours,
No.
couple hours?
No,
Just
it was
that
few
short.
minutes.
Wow.
This anger came over me, like I said, and that was it.
Wow.
And I never felt anything again. However, I was very lucky.
Yeah. So, but then how about the pain? Because, that was your 5 days in a hospital bed, 2 weeks on the medication, went through the withdrawal symptoms. Was your pain in your back still there from the original injury?
It was still there. It was much better. I started PT, and I think I went for a few months for PT.
And did that help?
And it helped tremendously.
Good.
And I thought that was cured, but he said it might come back, one of the, here and there.
Yeah.
And it did a few times where I ended up in a hospital again, and they gave me some medication, and it was in and out. I was there only for a few hours.
Yeah.
However, at some point, my neck started to hurt, and I was like, well, this is new.
Yeah.
And I thought maybe my neck, the pain was going up my spine.
Yeah. Well, yeah, and so that's a couple points in there because you have what's called the centralization of pain, and the body remembers when you have a really significant injury and an emotional, response around that. The body can actually hardwire that in. And so there's talks in science called neuroplasticity, and that basically that concept is neurons that consistently fire together then continue to kind of hardwire that messaging pathway into your system. So when you have a really strong both pain response and then tied to an emotional response around there, then your body, even after you've gone through the healing process and you strengthen with physical therapy and we're feeling much better, there are still times when that, your body can kind of remember. And sometimes it's a subconscious trigger, even looking at a kettlebell, or, you get up and you just, you have the flu or something and you're coughing and sneezing, and just that increased pressure, can, kind of re-trigger, some of the responses around that healing process, and can actually almost cause, your low back, because there's a neuromuscular connection, and so it can cause that low back to go back into spasm. So you were having some of those episodes, right? Maybe once or twice a year, you would say.
Yeah, the most.
Yeah. But then, so fast forward then to more recently, the low back may have been okay, but you were starting to get some stiffness, tightness in the neck, and you felt like it was becoming more chronic, right? It was coming more often.
That's exactly how I felt.
Yeah. Yeah. And so when you came in then, certainly we looked at the lower back from an x-ray perspective, and, we definitely saw some areas of misalignment, and we used motion x-ray. So we were able to pinpoint exactly where that lower spine was not moving. But then, as I was saying earlier, as soon as we went up and started looking at the neck, 2.5 feet away from the original problem, it became very obvious that the challenges that were there in the neck had been there for at least 2 to 3 decades. And so then you became very aware of what processes may have set that off whenever you looked at your x-rays.
So the funny thing is, it's day before when you were actually at the cooking event.
Yes,
correct?
yes.
Somebody was asking me, why did you leave Russia?
Yeah.
And we had someone who was a cameraman who traveled to Russia, and without blinking an eye, he said, well, you were probably persecuted being a Jew.
Yeah.
And I said, yes, well said. And I said, unfortunately, my twin sister, Olga, and I, we were physically abused for being not the nationality everyone was back in Moscow.
Yeah.
That's where I grew up. And that was it. And the following day, when I did end up in your office, you're the one who said, well, remember what you have mentioned yesterday.
Yeah.
Most likely, this has been, 3, 4?
Yeah.
Okay, not that many decades. But
I don't want to pinpoint your age unless you want to.
No.
That's on you.
But it's been, let's say, 4 decades of basically covering that injury, which I did have sustained when I was a teenager.
Yeah.
And to be honest, when you did say that, it took me a few days to actually process, because it brought all those horrible memories back into life. And it made me so sad to think that I never knew I had so many injuries right down to my neck, because you don't think about it. You're a kid and somebody beats the heck out of you all the time, but you don't think that you're going to be paying the price when you're an adult.
Yeah.
And I work, the line of work I do, I work with kids, teaching cooking classes, but I see a lot of kids, and it makes me, and I see bullying sometimes, and it makes me sad that people don't realize what can happen to a child going forward in life. And nobody really realizes that, once you're injured, once or twice, or maybe just once, your body might pay the price growing older, if you have not really done anything to fix this pain or whatever, which as a kid, you have no idea.
Well, and that's such a good point, because kids are extremely resilient, right?
Right.
They fall down, they get right back up, they brush it off.
They pick on each other, whatever.
Yeah,
Siblings do that, whatever. Things happen.
Absolutely. Well, and again, I ask people, sometimes about did you have any sports injuries? Did you have any major slips or falls as a kid? And they can't think of it. And then, they'll come back in a week or two, and it's like, I remember my brother putting me in a massive headlock and nearly ripping my head off. And it's again, they're playing, as siblings. However, they might not have any initial pain with that, but then that can set the ball rolling where it kind of locks the spine up. The term that chiropractors use is subluxation, but it's a whole complex where the spine misaligns and or stops moving properly. And it's kind of the quiet progression of that starts to interfere and causes issues with the body communicating, from the brain down to the body, and then the body sends messages back to the brain. And that communication process is so vital. So that's why I'm so adamant about checking kids. And I know you said you're going to get your daughter checked out at some point.
It is so important.
Yeah. But yet so many people don't realize the repercussions. Now, again, what you went through is so severe, that was the severe end of that. But even, even the sports injuries, kids falling over, in soccer. I saw a water polo player. She played water polo all through high school. And it's I'm sure I was smacked in the head pretty good with the ball.
Sure.
And it's those jarring responses, can cause minor head traumas and traumas to the neck that you never think of because, you might be a little sore.
Don't think about it, absolutely.
You might have a headache for a few days, but again, when you're in survival mode, like you and your sister were, that protective mechanism is survival, right?
Absolutely.
And the body just wants to get you through to the next day.
And we were young, so who thinks about it, right?
No,
just recover.
Absolutely. So, well, again, I'm so glad that you made it to, out of that situation.
Absolutely. And, and I talk every time I see if there's some sort of bullying in my class when I'm teaching, I stop my class and I say it's not allowed. And I want you to apologize. And I always ask what possesses you to even say this to someone.
Yeah.
And it has been proven basically that, when somebody's bullying someone, it means that human is being bullied in a different way.
Yes.
And he's trying to show the power.
Yes.
And he's just trying to basically show someone that he's better than anyone else. And it's like a mechanism, it's a self-surviving mechanism.
Yeah.
However, kids and adults don't realize really that it's not just emotional abuse, it's a physical abuse that is going to stay with you.
Yeah.
Right? And a lot of people say that it's better to have physical abuse because the pain will go away, the bruising will go away. However, and mentally stays with you.
Yeah.
However, clearly, in my case, it stayed with me in my spine.
Well, and that's just right. And so, it's like the superficial, just like, with all wounds, like the superficial wound goes away and you might develop a scar, but like the signs of the injury, physical, mental, emotional, still remains. And so that's why, getting connected with a healing profession, like chiropractic, acupuncture, PT, a profession or a professional who is going to help you through that healing journey, and facilitate that process and that can start, obviously, the closer to the original trauma the better.
Yeah.
But, the saying that we do...
It's better late than never. Right?
Well, yeah, the saying in our office is the best time to plant a tree 20 years ago. The next best time is today.
Right
so
now,
it's
absolutely.
So we can, even though the scars, the wounds, the trauma is there, we can help to heal those, those deep neurological, wounds that are there and help to, break that hardwired pattern of, for you, some of the physical chronicness that you were feeling in the neck and the low back, start to break through that. Again, does that mean you're never going to have another day of pain in your life?
Of course I will.
Of course we all.
And however, I also want to make sure that people don't understand it's not overnight fix. Unfortunately, because nothing is an overnight fix.
No, and again, that's unfortunately our society, right? Western culture is like instant gratification.
Instant, yes.
And again, a lot of times, you went back to the bullying. Unfortunately, someone who may have been, bullied, or is just in a tough family situation. What do? They turn, they turn to maybe a friend or someone who is like offering, a pill, or they're offering relief from the situation that they're in, and without knowing any better, what do? It's so easy to turn to that, and in less than 2 weeks, they can be addicted, and now it could be
we're talking about pills, but there's other more
significantly worse
other drugs,
significantly worse,
which I think you probably become an addict quicker than. Much less than 2 weeks.
Oh yeah,
I'm sure.
Yeah. Especially if you're talking about injection or something.
Yes, I can imagine.
It's one time. It can be an addict. So I really appreciate you sharing these, difficult conversations, because I think people need to understand that there is hope out there. And I really love that because of your experience with the bullying growing up, you're very quick to recognize it in a much smaller form, right? Because you're hyper aware. So, when you're teaching your class and you see a kid, nitpicking, well, could you even actually maybe share for some of us who maybe aren't as aware, like, could you share some things that you've maybe seen in your classes that you're like, that's not right, and you call it out? What do you see?
So let's say we're making something, and then somebody picks another kid saying either he looks different than the other kids do,
Okay.
or he's not cutting something correct, and he calls him stupid because you're this and that and that, or you're just in the bully's eyes, he's just not good enough. However, when I do stop the class and I say, I want to know what gave you right to even say this to another child, to another kid? We're all friends in the class. Are we going to be friends outside of the class? No, but we're friends in the class. And I expect, and I respect for every single one of you. I respect you, so you're going to respect me, and you have to respect each other.
Yeah.
We work as a team, and this is what I'm trying to teach every single kid who goes through my classes, is that you have to learn how to work as a team. You cannot just be there for yourself, because other people rely on you maybe as well. If we're making a dish together, if you did not make this part of the dish or whatever, you're slacking, or for example, not chopping this, the dish is not going to come out the way it's supposed to taste. Right? So team is extremely important, and I always talk about it. But if you're a teammate, how can you pick on your teammate? How can you do that to someone? Just because they look different, or we all have feelings. And that's how we were born. This is how we look, right? Does it really matter how tall or short you are? No, it doesn't really matter. If you have hair or you don't have hair, does it really matter? No.
It brings I remember reading in a book, kind of like the evolution of us as human beings, right? And we come into this world, we're born, and we're completely dependent, right? We're totally dependent on, our parents, a caregiver to, give us food and give us shelter and dress us, make sure we're clean. We're totally dependent. And then we start to hit that, 3, 4, 5, 6-year-old, and we want that independence, right? And so now it's like we're separating ourselves. I want to do it, and I want to do it my way, and that can go all the way up through adolescence. Even post-adolescence, young adult. It's like I'm independent, but eventually, and unfortunately, I think a lot of adults lock in at that. I'm going to do things myself, and it could very likely be related to like a past trauma. But eventually, the most successful people just in life, and I don't mean that financially, I don't mean that, but like successful with, relationships, is that you evolve to an interdependence, right? We all rely on one another. So I love that you're talking about.
And it's important to understand that. It's okay if you cannot fix something yourself.
Yes.
That's why there's someone else you can help you with that, right?
Yeah.
We cannot do it all, and it's okay to make mistakes. It's okay not to be perfect. And I teach this all the time. Yeah. We're not perfect.
Yes.
Nobody's perfect.
Exactly.
You cannot even put two pencils together. They're all different. Two pencils are different, even they're made in the same manufacturer. Yeah. We're all different. And it's okay to be different. And that's why I started my YouTube for cooking classes, traveling the world through cooking for kids. And I always say at the end, I use a lot of Mr. Rogers saying that, love your neighbor, be there for each other, be appreciative of each other, and always be there to help each other, because it is important. You're not the only one you're not the center of the universe. You have to think of other people as well.
That's right. So, that is such a beautiful place. We're going to take a break real quick, but tell people, how can you mentioned the cooking classes that you do online, how can people find that?
So
we'll of course leave a link underneath, in the podcast. But how can people find you on there? So
the name of the business is Isabella's Gourmet Chow. The business was named after my child Isabella, and she was named after my beloved grandmother. So again, it's Isabella's Gourmet Chow, and I have a website, I have Instagram, I have basically all the social media there is. I have it.
That's awesome, Sofya. Thank you so much. We're going to take a quick break, and we're going to come back, and we're going to chat a little bit deeper about, a little bit more about the nutrition and the cooking side of things, and some of the populations that you serve.
Absolutely. Yes, sounds good.
All right, we'll be right back.
You've been listening to another episode of What the Health? The podcast where anything health is fair game, with your hosts, Dr. Dan, Angela, and Dr. Riley. Brought to you by Chiro Family Chiropractic. If you'd like to learn more about some of the resources mentioned on this show, or you have questions about something that was discussed, please reach out through our website at www.turofamilychiropractic.com. Remember to like and subscribe to What the Health Podcast to catch all the latest episodes and replay your favorites. Thank you for listening, and remember, we're always here to help when you find yourself saying, "What the hell?"